Have you ever wondered why cardiac health is crucial to your overall well-being? Well, think of your heart as your body's indefatigable engine, ceaselessly pumping fuel to every cell, every second of the day. Just like an engine, your heart requires constant maintenance to perform optimally. But how do we keep tabs on our heart's health, you may ask? The answer lies in the realm of medical science, particularly in a cardiac panel. The cardiac panel is an essential tool in assessing the health of our heart. So, what exactly is a cardiac panel? Well, the cardiac panel is a group of tests that provide a comprehensive picture of your heart's health. Think of it as a team of detectives, each with a unique skill set, working together to solve the mystery of what's going on inside your body. Now let's meet the team. First up is AST, or aspartate aminotransferase. This enzyme is typically found in your liver, but guess what? It also increases when there's damage to the heart. So if your AST levels are up, it might mean your heart is sending out an SOS. Next, we have CKMB. This enzyme is like the flare gun of the heart, spiking when the heart muscle is injured. Elevated levels of CKMB can often be the first sign that the heart is in distress, giving doctors a crucial early warning. Also, this is a subtype of CK. It is more sensitive for finding heart damage from a heart attack. CKMB rises 4 to 6 hours after a heart attack, but it is generally back to normal in a day or two. Because of this, it's not helpful when a healthcare provider is trying to figure out if your recent chest pain was a heart attack. Then there's creatine kinase. This protein is a bit of a generalist. It rises when there's any muscle damage, including to the heart. Think of it as the all-seeing eye, keeping tabs on all your muscles, ready to raise the alarm if something goes wrong. This enzyme can also be measured several times over a 24-hour period. It will often at least double if you've had a heart attack. But because levels of CK can go up in many other conditions besides a heart attack, it is not very specific. Now let's talk about troponin. This protein is the heart's specific marker. It's like the heart's personal bodyguard, and when there's trouble, it's one of the first to show up. This protein is by far the most commonly used biomarker. It has the highest known sensitivity. It enters into your bloodstream soon after a heart attack. It also stays in your bloodstream days after all other biomarkers go back to normal levels. In other words, this cardiac marker takes the longest time to return within normal range. Two forms of troponin may be measured: troponin T and troponin I. Troponin I is highly specific to the heart and stays higher longer than creatinine kinase MB. Current guidelines from the American Heart Association, AHA, say this is the best biomarker for finding a heart attack. Elevated troponin levels are a clear sign of heart muscle damage. Next in line is LDH, or lactate dehydrogenase. This enzyme rises with tissue damage, including that of the heart. It's like a damage control specialist, chiming in when there are significant tissue damage and distress. And finally, we have myoglobin. This protein increases with muscle injury, including the heart. It's like the rapid response unit, often one of the first to respond to muscle injury. And there you have it. Each member of this team, or each component of the cardiac panel, plays a vital role in providing a unique insight into the health of our heart. Each component of the cardiac panel provides a unique insight into the health of our heart. Why is understanding the cardiac panel so important? Well, let's dive into that. The cardiac panel is like a window into your heart's health. It's a crucial tool that helps in early detection of heart damage. By measuring the levels of specific enzymes and proteins in your blood, like AST, CKMB, creatine kinase, troponin, LDH, and myoglobin, it can indicate if there has been any damage to your heart muscle, often before symptoms even appear. But it doesn't stop there. Why do I need this test? You may need this test if your healthcare provider thinks you're having or have recently had a heart attack. You may also need this test if you have symptoms of coronary artery blockage. Symptoms of coronary blockage may include chest pain or pressure that lasts for more than a few minutes, pain or discomfort in your shoulders, neck, arms, or jaw, chest pain that gets worse, chest pain that doesn't get better by rest or by taking nitroglycerin. Other symptoms that may happen along with chest pain may include sweating, cool, clammy skin, or paleness, shortness of breath, nausea or vomiting, dizziness or fainting, unexplained weakness or extreme tiredness, fatigue, fast or irregular pulse. The cardiac panel also guides treatment decisions. Based on the results, your healthcare provider can determine the best course of action to care for your heart. This could involve lifestyle changes, medication, or even surgical procedures. Moreover, it's not just about diagnosis and treatment. The cardiac panel is also used to monitor the effectiveness of treatments. By comparing results over time, doctors can see if a treatment is working or if adjustments need to be made. This allows for personalized, targeted care that is most beneficial for your heart health. So you see, the cardiac panel is more than just a set of numbers. It's a valuable tool in preventing heart diseases and improving heart health. It provides insights that can lead to early intervention, informed treatment decisions, and effective monitoring, ultimately contributing to better heart health outcomes. Remember, understanding your cardiac panel is a step towards a healthier heart and a healthier you.